My name is Michael Colaswano. I am the Vice President of Admissions and Growth Strategy for Harmony Health Group. I oversee our admissions department. I also oversee payer contracting, some parts of revenue cycle management, alumni team, as well as our central business office. So Harmony has been around since 2015. We started off with 2 organizations. We now have 14 in 5 different states. We provide detox residential, mental health residential, PHP, and IOP for both mental health and substance abuse. Before we implemented Dazos, we were utilizing Salesforce, as many large companies do. Salesforce is a great platform. However, it was extraordinarily costly to build out. You needed a lot of in-depth knowledge or the right people and a lot of money to pay for the right people to build out integrations and get the type of insights that are needed to excel in our space. One of the biggest challenges that I personally had at the time that we implemented Dazos, I was our director of admissions, was surrounding rates of reimbursement and making better choices for placement of which clients to take at which location. When you have a multi-site organization, a lot of times there's value in placing a client at one area versus another area from a revenue cycle management perspective. And I can tell you that that was one of the fastest fixes when I was given access to Dazos IQ. Our ADR, which is our average daily rate, actually went up by about 15% that next year. So those problems that I was facing before we had this software, it was twofold. So on one hand, the extraordinary expense of maintaining and building out the Salesforce platform caused budgetary restrictions within my department. So I wasn't able to hire the number and quality of personnel that I needed to hire at the cost that we were spending on maintaining realistically our basic infrastructure and trying to develop Salesforce into what we needed it to be. So we talked about the problems that we were having prior to choosing Dazos. Nobody experienced those problems more than our founders. And our founders wanted a solution. And one of our founders came from a tech background and they created the solution themselves. The first product was Dazos IQ, which I got access to. And like I said, our ADR skyrocketed. The next problem was the problem with the CRM. So he created a CRM and we were the first company that beta tested it. We worked through the kinks. We built it out how we wanted it to be built out. And that was a really fun process because anything I possibly could have wanted in a CRM, I was able to get and have it developed for us. And then now, everybody else gets to experience my baby and our baby. Since implementing Dazos, we've seen a number of core metrics improve across a wide variety of areas. The first of which was when I was introduced to Dazos IQ. Over the next year, our average daily rate increased by about 15%. And I can only attribute that to my access to the data and the power of the data that is housed within the IQ platform, which is my own data through CollabMD. They do interface with a number of other systems. We have Collab and it has a very direct integration with Collab. And by using that data, I was able to make better data-driven decisions on placement for clients and maximize on the return from the work that we're doing. Another core metric that I saw improvement on since we integrated Dazos into our platform was on alumni readmission rates. I worked with the Dazos team to develop an alumni dashboard with a lot of widgets that will actually help model our workflow to actively engage post-discharge with clients. Since that time, our alumni readmission rate has gone up by 700%. The last core metric that I'll touch on that we've seen improvement on since Dazos is our overall admission and conversion rate. Through the way that Dazos is set up and also the iVerify platform, we've been able to approve policies faster, get admissions in faster, and improve our conversion rate substantially. This is a tool that hasn't been seen before in this space. It's a tool that comes out of the box in a way that was built by behavioral health professionals for behavioral health professionals. It was built with an admissions team for an admissions team. It was built for operators with operators. For somebody that is owning and operating or running a behavioral health program, if you think about what's important to you, it was important to them too, and that's what you're going to get. Our entire company is a win story at Dazos. We were the first people to use Dazos. We've been using it for about 4 years. In that time, we've gone from 6 programs to 14. During that period of time, the only way we were going to fund that growth, which we did without outside income, without outside investment, was by our own profit margin. And if we didn't have Dazos, I don't know that we would have the same profit margin to be able to fund that growth. What excites me the most about Dazos is the fact that it all works in tandem to get me all of the insights that I need. The CRM is built upon the data that we enter into it. It helps us organize our data. It helps us make better decisions. It helps us to continue to stay on top of and follow up with our inbound clients. It also helps us to continue to stay on top of and follow up with shortcomings at the facility. We track our facility KPIs through Dazos. We track our outcomes. We track our lengths of stay. We find holes in our organization long after the sale is actually made. And then all of that data then conjoins with the billing data in IQ, and I can run, ROI reports. I can look at average time to pay. I can look at, if there are hiccups in our billing process, if there are hiccups in our UR process. Now that Dazos has developed the billing CRM, we integrate with our billing company CRM, and I can track UR data and trends all the way from direct from the source at the billing company all the way through our integration with HIPAA. Every part of Dazos builds upon the other. I verify, I no longer have to double enter every time I try to run a policy. It cut down, hours of time for my team and the team of our call center by not having to double enter data, by being able to run a policy, see that policy, have it visible to me while I'm driving on 95 on the way home, and make an approval if an approval is needed from higher up. Everything works in tandem, and I'm excited for the new products. The iCampaign product, I'm extraordinarily excited to beta test that. We get to beta test every product as it comes out and work through those kinks still as they start developing new products and verticals. So I'm super excited for that as well. I like Dazos because it's intuitive. It's easy to teach to people. And when people come on, it doesn't take me that long to get them up to speed.